Good afternoon and welcome to COVID-19 and our Black and Brown communities, a Zeta Rise discussion dispelling vaccine myths. The COVID-19 disease has had our world on lockdown for about a year now. During the pandemic, the Black and Brown communities have been hit especially hard, economically and medically. It is one of the initiatives of Zeta Phi Beta Sorority through our Get Engaged Social Action Initiative to mobilize the communities in which we serve through education, service, and advocacy. Today, we want to dispel some of the myths and share some information about the COVID-19 vaccine. My name is Angela Forrest of Zeta Phi Beta Sorority, and I will be your moderator for today's discussion. Let me begin by introducing our panelists for today's discussion. First, we have Mr. Sam Centellas, the Executive Director of La Casa de Amistad, a Latino-focused nonprofit community center on the west side of South Bend, Indiana. Sam was born in Santa Cruz, Bolivia, and came to the States in the first grade. Sam joined the staff of La Casa in 2013 and quickly doubled their fundraising income and started their first endowment. Under Sam's leadership, La Casa launched its immigration legal program, City ID programs, and West Side Wednesday to empower neighborhood businesses. Sam's involvements range from economic development to leadership development of college students and community organizing. Sam was appointed by the mayor of South Bend as a commissioner to the Housing Authority and to the Diversity Utilization Board, helping develop minority and women-owned businesses, and served on the steering committee for the West Side Main Street projects. Welcome, Sam. Isaac Hunt is a prevalent face in the Black community. He is currently employed at Goodwill Industries of Michiana as the Group Violence Intervention Save Community Liaison for GVI Social Services for the Group Violence Intervention. Isaac is also the founder of Save Outreach. He coordinates activities related to gang violence, gang prevention and intervention, counseling and mentoring, establishing mentorship programs for gang or group members related to violence and prevention, communicating with family members of young men and women who are inclined to demonstrate gang violence involvement. He is also the owner of Hunt's Associates, LLC. Welcome, Isaac. And Dr. Stephen Patton earned a bachelor's degree in biology with a minor in chemistry from Kentucky State University, Frankfurt, and a medical degree from the University of Pikesville, Kentucky College of Osteopathic Medicine. Dr. Patton completed his family medicine residency at community hospitals in Indianapolis, Indiana. Dr. Patton is board certified in family medicine and is a member of the American Osteopathic Association. In 2021, Dr. Patton was named Medical Director for Community Outreach. In this role, he participates in educational health programs and events with a focus on addressing health equity in underserved areas. Dr. Patton collaborates with the Institute for Health Equity, a part of Norton Healthcare, to strengthen community relations and access care in effort to improve health equity statistics. Welcome, Stephen. And we have Robin Vita, who's the from the St. Joseph County Health Department and the Director of Hope Outreach. She's been with the Health Department for over 14 years, and she oversees the healthcare prevention outreach for our city. Welcome, Robin. We also have with us two members of Zeta Phi Beta Sorority, Mrs. Dorana Bird and Mrs. Alice Williams, who serves as the South Bend Chapter President. Welcome, everyone. And thank you for being with us here today. And we'll just dive right into this. So I had a question for either Dr. Patton or for Robin. Can you tell me what this, talking about the COVID-19 vaccine, because that's what we're going to primarily focus our discussion on today, is can you tell me what the vaccine is actually supposed to do?
All right, well, I guess I'll take a shot at it first then. Angela, I guess also, is it Angela or Angelique?
Angela. It's Angela.
Angela? Okay. I just wanted to give a special thanks to the ladies of Zeta Phi Beta, especially since it's International Women's Day. So I want to say I appreciate everything you all are doing, and it's definitely noted in the community. So thank you for that. As far as talk about what the purpose of the vaccine is, I guess a good analogy would be um, it's another tool in your belt to help protect against the virus, same as a bulletproof vest per se. In cases you might still feel some pain or have some symptoms if you were ever came across that unfortunate incident, but you necessarily won't die from it. And I think that's the main goal of the vaccine is to decrease serious risk or death from the vaccinations. In fact, the two that's out right now have about a 95% of effectiveness at doing their job at preventing serious death or illness. Now, I'm not saying that may have some symptoms or be asymptomatic. That's still under study because they didn't necessarily focus on that, but that's the main purpose of the vaccines.
Mm-hmm. Yeah, and in just a second, what Dr. Patton has mentioned, really when we look at the vaccine, it looks to one of the questions we get the most is it going to actually infect me with COVID and make me sick? Right? And to that, the answer is no. Really, it's causing your body to build antibodies to the spike protein. Most of you've seen what the coronavirus looks like. It looks kind of spiky. Think of that like Legos, okay? And really what it's doing is it's the vaccine, once inoculated, will cause your cells to make antibodies to fight that spike protein in the event you'd ever come into contact with it. It's extremely effective in preventing death and severe COVID infection, as Dr. Patton mentioned, which is extremely important when we look at gaining control over the pandemic. The second phenomenal piece is, yes, if somebody were to become infected, that the symptoms would be mild, potentially somebody would have no symptoms, and that's where now a lot of our efforts have shifted to transmission. So somebody who has been vaccinated, do we know whether or not they could still transmit the virus to others in their household or other individuals? Early studies right now show that transmission is decreased around 75%. So that's huge when thinking about it. And it's not that we didn't want to study that from the beginning. It's just our main effort when we first were developing these two COVID-19 vaccines, and now Johnson & Johnson just received emergency use authorization last week. It was really us looking, how do we stop people from dying right in this moment? And now we're shifting to say, okay, we know it prevents severe COVID. Now, how do we see it does it control for transmission? And we are beginning to see that is the case. CDC coming out with new recommendations today, I think was promising. That's why on one end, we're saying once we're fully vaccinated, there's different activities we can do. We may not, probably would not have done if we weren't vaccinated. However, for the interim, we're still paying attention to physical distancing, the mask wearing, because we just haven't reached that level of vaccination saturation yet. And that was a lot. And I promise I'll be not as wordy going forward.
Well, that leads me to one of my myths or gray areas that I've been hearing, that, there's 3 different vaccines. What's the difference in these vaccines? Because I've heard that the Pfizer and the Moderna are sort of like blockers against the virus, and that with the Johnson & Johnson, it's almost like a flu shot where they're injecting you with some of the antibodies from the actual vaccine to sort of build up your immunity. So can you sort of clear up some of the confusion about that?
Yeah, I will give it a go, and then I'll have Dr. Patton back me up here and fill any of the holes that I've forgotten or may have missed. So Pfizer and Moderna utilize an mRNA technology. So it's actually using some messenger RNA that once it reaches your cells, tells your body to produce antibodies to fight that spike protein. So that's the big thing with Pfizer and Moderna is there's no COVID, no virus, no carrier, anything, except they use like a fat module to like get it into your body. But really it's the key thing is it's messenger RNA that tells your cells to do something. That also can be an area where individuals ask, well, does that mean that it's going to change my DNA? And the answer is no, because messenger RNA does just that. It only tells your cells to do something, and your DNA is actually locked in the middle of your cell, and mRNA never gets in there. So that's Pfizer and Moderna. And I think that technology is going to be a pathway for new vaccine development as we move forward, because there's so many advantages to actually being able to program your body to do something, such as develop an antibody to a spike protein, because it leaves less room for reactions and those types of things, because it's your body working to do something. Now, Johnson & Johnson, slightly different technology, more so the traditional sense, where it utilizes the adenovirus, which is a common virus that causes the common cold, to create that immune response. So what it does is it inoculates somebody with something, not enough to make somebody sick, right? But enough to cause your body to say, wait a minute, you don't belong here. And it's going to start to build that antibody response. So in the event it would come into contact again with some of those spike proteins, you'll have the army there already to attack so the person doesn't feel sick.
No, and I tag along with Rob, exactly like she was saying, as far as the mechanism of actions. And as far as you were asking which one is better, all three of the vaccines are very effective at preventing death.
Yeah.
And I think that's the main goal of any of the vaccines. So if you have the opportunity to have access to any three of those vaccines, I would say definitely go forward. There hasn't been any significant side effects with any of the vaccines as well. So that's the other major portion of it. They all work differently, but the end goal is, are they preventing deaths? And the answer is yes.
Yes,
so you can get sick, but you probably won't die.
Correct. You still may have a mild case, but you are not going to die as a result of infection. Correct.
Okay, thank you. So Sam and Isaac, I want to get you guys in on this conversation too. So can you, either of you or both of you, and one at a time, tell me some of the concerns that the Black and Brown communities have about getting the vaccine? Because I know at first I was like, I'm not getting this because I don't know what they're putting in my body. But as time gone on and I saw a little research and more people got vaccinated, I was a little better with it. And in fact, I did get my first vaccine shot last week. But can you share with me some of the concerns from the Black and Brown communities regarding the vaccine?
You, me, Isaac, you called on two of us. So
yeah, either way.
Either or, I actually called on both of you. So
we'll go with looks. So I'll go first. So I'll share a couple things that are interesting. So one, I'll tackle a little bit from the religious side. So some of the kind of anti-religious rhetoric around the vaccine has been that it's like there's aborted fetuses that were in the vaccine or whatever, and things that honestly, to very well-educated folks or well-read or well-connected people, right, sound almost crazy, but to people who either don't speak the language, aren't reading all these things or working two jobs and just trying to focus on feeding their kids tomorrow, aren't connected in that way, right? And even me, right? I have a master's degree, but I hear the doctor and Robin talk about medical stuff, and I'm like, that was all like Chinese to me. But I trust them and I trust Robin. I've known her for years, and so I'm going to get a vaccine when it's available to me. So that's one, is like from the religious side, there's been a lot of misinformation. So we're kind of trying to communicate, go right at that. The other like two things that are interesting and unique, I think, to our community. One is, there's a percentage of our population that's undocumented. And so there's a real challenge there about like, am I going to get in trouble? Like, is there going to be police there? Is there going to be, and so there's fear about anything governmental, right? And that could be from, getting a shot to going to pay your property taxes, right? So people have a fear about like entering the county city building or those things, or any place where they're going to get asked for an ID. And so all those things are worrisome for a portion of our population. And then that kind of spreads to other people. The third one is partially because of the undocumented status, but also just because folks are low income, is the worry about insurance. And no matter how much you tell people something's free, but they still, at all the places, they still ask, right? Because I've been COVID tested. Luckily, they have not had it yet, but I've been COVID tested, and they always ask because you get your insurance information. And I have it, but if I didn't, I'd be like, well, let me go get it in my car, and then I leave, right? And so we're trying to be really clear about that. And I actually have, I don't know if Robin's heard my joke on it, but the other thing about it being free is I think people have a leery thought about anything free, which you're giving away, right? So it's almost like they just charge $5 for it, and more people will come. Because I'm like, I paid $5 for it, right? Versus like there's a real fear around it. So if it was just like no insurance needed, everybody just pays $5. I think people would be less worried about it. Versus like it's free, you don't have to have insurance, but then the flyer says bring your insurance card. And so because obviously we want Anthem Blue Shield to play as much of their share for this as possible. So I think like that, those are a couple of the pieces, and I don't want to jump into some of the others, we'll say for later convo, but it's those kind of three pockets that have got our community a little bit apprehensive about the vaccine.
I would like to echo what Sam has said, even though he thinks he looked better than I do, but that's fine. In our community, the African American community, first thing everybody started thinking about is the Tuskegee Airmen who was injected with syphilis, right? And when we go to our health department, do they look like us? Do we have representation, right? With the work that we do out in our community, helping people with gun violence and stuff like that, and involved as an essential worker and a frontline worker, we have placed ourselves in precarious positions last year. Even when we could not find masks and hand sanitizer, we were out here trying to pass out masks and hand sanitizer around our community, trying to help people. African Americans, especially in the culture that we're in today, with everything that was going on in the White House and everything else, we were not going to take a chance, including myself. You may be trying to give me something that's trying to wipe me off this planet. So I'd rather just not have it and take my chances, because I already got PTSD for everything else that's going on in my neighborhood. So I'm real blunt and straight up about it. But in October, we had a shooting here in this city, and a couple people on our team ended up getting COVID. And I know I had COVID because I was in the car with the individual, but they told me I was negative. And I'm still trying to figure out how has he got COVID. We've been riding around the whole time. I got the same set symptoms. It really started making me look at, do I want to die at 54 years old? I need to really start looking into this. And my brother, who's a doctor, and my sister-in-law is a nurse, called me on the phone and said, get the shot. I took the shot because I knew somebody that looked like me told me it was a good thing to do. Then when I found out that Dr. Corbett, who was the leader of creating the Moderna, made it even more comfortable for me, because I know what she's doing. I'm hoping when she's doing her work, she's being constantly aware of her science, what she's doing with science. Science has not always been favorable to African American and Latino people across the United States. And so we start saying, why should we trust them? So I said, if I'm a leader, I must take the step. And I got the first shot and I got the second shot. And then I started doing PSAs through the help of Dr. Bob and Robin being able to do this and bringing some other African Americans along at the same time. Because I don't want to die. But I have to find some kind of trust somewhere. And I had to trust on my Lord that you're going to keep me alive. So I'm going to take the test. I took the test and I'm still here.
That's good to hear. Dr. Patton or Robin, do you have any comments on Sam and Isaac's comments?
Yes, a lot of things they're talking about is definitely right on the money, and it just addresses some of these things why the even African American and Hispanic populations sometimes are disproportionately affected, and it kind of does bring to light some of the social determinants that affects that, and those social determinants play a major role in why the virus is able to spread so rapidly to those communities. As far as we're talking about transportation, do we have access to care? Do we have representation? Do we have neighborhoods where we're able to exercise and keep off this weight? So that highlights a lot of things because the same token, the virus focuses more on, is able to thrive more in those people that are obese, have hypertension, heart disease, diabetes, which it also affects higher, specifically in the African American community, affects is more prevalent. So I think by engaging and having these conversations and acknowledging that, yeah, medical history hasn't always been on the best side of African Americans. We have to acknowledge that and also factor in that, hey, a lot of ethic boards and committees weren't around that time. A lot of physicians, even now it's only like 5%, but it's more than it was back in the day, right? But we have to acknowledge that to start gaining trust. But we also have to address some of those social determinants, as those people were saying, because we have to see the whole system, the system as a whole. And I think one thing, I guess, is a positive thing, which is real positive, but it highlighted some of those deficiencies in the health equity throughout the U.S.
Okay. Robin?
Yeah, and Isaac and Sam, they've been phenomenal leaders working with me at the Department of Health, probably for almost 8 weeks now on this. We knew that our Black and our Latinx communities would be the most apprehensive, I think, about taking this vaccine because of the historical trauma, just not within the medical community, but in the government community. And we've been trying to, and then and it's and for us, it's so frustrating, right? Because what was it, 2 weeks ago, Indiana shifted from vaccinating really anybody who lived or worked in Indiana to only vaccinating those that live in Indiana and somebody having to show proof of residency. And the first thing we thought is, oh my goodness, we've been doing all these PSAs about how an ID is not required, insurance is not required. If you have it, great. We're only using it so that we can get in touch with you for the second dose, right? Now we went to, and at first I was like, get rid of proof. Just get rid of proof because it just sounds official, right? Let's just say it's open to individuals who have documents that show residency, right? We don't care. And Dr. Einters has given us the directive that we will always err on the side of vaccinating somebody rather than on the side of telling somebody they can't get their vaccine through us here at the department. Which, because there are times when we're like, ooh, and I'm like, nope, we're erring on the side of vaccine. Just if they're here and they want it, just give it to them. We'll figure out. I'd rather ask for forgiveness later. But that's a clear barrier. The ID and the insurance. And I think we have to be clearer as to why we're asking for those things. And I've been trying my best to work around language for that. But then also too, just this, like I heard several things anecdotally working at the clinic, specifically for individuals who came in on a standby list, that they were worried that we were going to call them frequently to check in on them. And I was appreciative that the gentleman who was asking me the question was on the phone talking to somebody, because I'm like, no, we most certainly will not be calling every 2 hours to make sure you're okay. Because that's a real concern, and why somebody like his wife was like, I'm not getting it because I'm not going to have them call me and be in my life. So completely understand that. and we're able to address it. So we've been trying to be clear about the adverse, they call it VAERS through the CDC, but then the State Department of Health has their own like tracking system for severe reactions. That they do send a text message every week for like the first month. But again, we've just been trying really hard to be very non-contradictory on the language. Another big barrier we identified very early on, and thankful for Sam's support through La Casa de Amistad and the library, was that the site you use to schedule the appointment is only in English. So you can see who's eligible in Spanish, but then when I go to click and actually schedule, it's all in English, and there's no way it can be translated. So what we did from the department was we did two things. We put a video, so we had somebody actually speak in Spanish among going through the steps. But then if somebody doesn't have time to watch a video, which most times I bypass the video, I'm like, just show me what I need to do. We did some screenshots with arrows with Spanish language telling somebody what that was, or what the question was, or how to complete that. And then we're looking at doing some registration events this month to help individuals, because the system is cumbersome, and that can be scary too, right? They're asking me this information, and then I'm attesting that it's really me, and just they want the vaccine, and because they want to protect themselves and keep themselves from dying, just give them the shot is kind of how we've been trying to best be on our end.
I want to take a moment right now to open it up also to Durana or Elise, if you have any questions as well.
I did put a question in the chat. I was just wondering if you could speak to the fear that people have about the vaccine coming out so quickly. I think a lot of people are nervous about that because they're like, oh, well, this came out so quickly. How can it be effective? So if you could kind of talk about that a little bit and how that process works.
For sure. And that is by far 6 months ago, hearing about a vaccine, I was, as a public health professional, like, nope, not doing it. Dr. Fauci does it, maybe I'll think about it, right? Because there was this even the word, right, warp speed, that even gives the connotation that it was done quickly with corners cut and that type of thing. But in all honesty, coronavirus vaccines have actually been in development since the very early 2000s. So SARS, or if you look back at it, they've kind of, so the original SARS or CoV-1, if you want to look at it that way, super fatal, like 80% fatality rate. Very early on, we heard about it for a very short amount of time, predominantly affected individuals in Asia. And then we were lucky, it mutated itself out of existence. And we haven't really seen it pop up again. So when that originally, we started to identify SARS first, coronavirus vaccine development began. So they were already working on the genotypes and sequencing and identifying what it looked like so they could begin to identify ways to attack it. But then, as you can imagine, as SARS went away, so did the resources needed to continue that development. And most times with big vaccine research projects and things like that, there are these 4 or 5 year grants that come out. And if you miss a cycle or you don't get awarded a cycle, you wait a whole nother 5 years to potentially gain that access again. So what happened with SARS-CoV-2, which we now know is the virus that causes COVID-19 infection, we were able to identify quickly the sequencing of this SARS-CoV-2 virus and begin to identify ways to attack those spike proteins because of all the work that had been done the last almost 20 years. And then really the warp speed, what came in was that unlimited amount of resources. we had pharmaceutical companies, researchers, individuals who were able to gain the access to money and funding and equipment and those types of things that we normally would not have in traditional vaccine development. And that's really where, if you want to say red tape was removed, it was really the red tape of needing those, needed the money to do it, and then having the access to individuals who quickly participated in trials, right? People wanted to see, they saw the vaccine as a potential end to COVID-19. They wanted to, we saw more participation, more willingly in the beginning. And I think we're hopeful where we see that if we have more funding available, vaccine development for other infectious diseases can occur more rapidly if we have the means to do just that. So it's not that we skipped over things. Several of Pfizer and Moderna's trials were stopped several times throughout their period of study to identify and ensure that individuals who had reactions, it was not a reaction to the vaccine. Right. And we've even seen a few companies that started. Merck, for example, had started, and they've just completely thrown their stuff away because it wasn't as effective as some of the others coming out, and is now agreeing to work with Johnson & Johnson on the development of and distribution of their vaccine to ensure that there's enough out there. But yeah, that's hands down probably the first concern we hear, is it happened too quickly. But as you dive into really the process, you see that it's actually been several years that individuals have been working on a coronavirus-like vaccine, which allowed us to very quickly manipulate what we needed to identify what we needed to put into those vaccines.
Great, thank you, because that was one of my biggest questions too. How did they get this so fast? They can't come up with anything for AIDS. But
right. Yeah.
Question in regards to how long you think it will be before they decide to provide it for the college and universities as a must? I'm just thinking back when I was in college, back in the 90s, the early 90s, when meningitis was out, and I got meningitis, but the vaccine wasn't available. I mean, it wasn't required for college and universities until the 2000s. And so that's a concern that I have now, since I have children in college, that, it's rapidly, they're infecting. You hear about it here locally all the time with the University of Notre Dame, all the increase in the cases. So I'm wondering how soon. I mean, I know we just went down to 50 and above. I'm still not eligible. Got one more year. But just for the universities, I know in it's state by state, just, I know a colleague has spoke about her son in Illinois, that their university is offering it to their staff and students. So I'm really concerned about that, especially when we've been in it almost a year now, and the universities are talking about going fully in person in the fall. So I was just wondering how soon you think they will move to getting the universities and colleges as as requirement aspect of it.
Yeah, and that's a phenomenal question. I am hopeful that by the end of April, anyone who is looking for a vaccine and will be eligible for that vaccine. We've been able to, and especially with Johnson & Johnson coming on board, there's more vaccine now for those individuals that want it. Up until recently, we've really seen the demand has outweighed the supply, and eligibility will move quicker now that there's actually more vaccine. And we're hopeful that, by the end of this month even, it's going to look very different for who is eligible for a vaccine. At the Department of Health, each day we're vaccinating 1,000 individuals. And I believe close to 42,000 individuals in St. Joseph County have already received at least one dose of the vaccine. So I'm hopeful as we continue to receive increased allotment, we'll continue to increase that eligibility. And we saw that educators were able to come on, be vaccinated through the federal pharmacy program, which is huge. And I think our higher education individuals are not too far behind.
Good. Thank you.
Mm-hmm.
Dr. Patton, would you like to weigh in on that, any of this?
Yes. I echo Robin. I just think of the as far as the protocols, getting the vaccine out, and I also just want to give a special recognition to I like the way things are being handled. I mean, there's been over, I think, almost 90 million people vaccinated altogether. About at least 58 million, 50 something odd million, like 17% of the population have at least received their first dose of the vaccine. And we also want to look at the trend. I think the weekly cases of the COVID-19 virus is starting to significantly decrease, almost by 75% compared to earlier in the earlier January. So I think the protocol, the criteria that they're doing is definitely working. And like she said, maybe around the end of the April, we can start getting that out more, especially now that we have another vaccine, let's say this one dose vaccine, and it doesn't have to be kept in such cold temperatures, which means that we can give it access to a lot of other populations that normally aren't so close to big city areas that can refrigerate at those lower temperatures. So I think a lot of excitement is going on, vaccinations, decrease in cases, and continue going on with the protocols is going to be a beautiful thing.
Okay. Great, thank you. So a question about the vaccine. How long after you take both doses, that's saying if you get the 2 dose or if you get the 1 dose, will it be before you are actually protected? And how long does the vaccine actually last?
Mm-hmm.
So that's a great question, and it's another thing I wanted to hit on too. People are always asking me, how long does the vaccine last? How long do I have active immunity if I've already had the virus? First, I'll talk about with the actual virus. We know for at least 3 months you're going to be protected. They haven't done enough study to see how long you're going to be protected overall, so that's why they're still suggesting get the vaccine. Mm-hmm. Now, as far as the vaccine is concerned, either the Pfizer or Moderna, about 2 weeks out until your first vaccination, you're already about like 80% protected from those serious sickness or death. But both of them do require a 2-dose shot. And so after you get your second one, Pfizer is about 3 weeks apart, Moderna is about 4 weeks apart. You get your second one. And then like Robin was discussing before, normally on the second vaccine, you start having more of those side effects, which is really just your body reacting. That's how you want your body to do it. It's a reaction. They practice like they play. Mm-hmm. There's no actual virus in there. It's just the immune response of how the body will react if they actually saw that antigen or that spike protein in real life. So that's a good thing.
So what are some of those symptoms that you might see?
Yeah. So some of those symptoms are the same things. If a virus or a bacteria really wants to have its way, or a fungus, it'll come in there and do its work and we'll pass away. Normally, it's our body's immune system that's fighting those things, and are actually the things that are causing those side effects for the most part. If something's in our gut disturbing us, we're trying to flush it out so you can get diarrhea or vomiting, your body's trying to get it out. We increase our temperature because those cells that fight against those bacteria and other antigens or other germs work better under higher temperatures. So we get a fever. Our airways, the cilia in our airways start to conduct and move faster. It's trying to clear anything out in the lungs. So we get these coughs and fevers and body aches, different histamines, increasing blood supply, so more troops can get to wherever the source is. So we feel flushed sometimes. So a lot of these symptoms that we're having is our body doing the work, right? And it's reacting to the virus. So you're going to have some similar symptoms when you get the vaccine. You may feel like you got the flu, may have a headache or some muscle aches, but that's really our body reacting, which is what the vaccine was intended to do, to activate that immune system. Now, after you get your second shot, about 2 weeks after that, that's when you notice that 95 percentile for the Pfizer and Moderna, where you have decreased significant illness or death. And as far as the Johnson & Johnson vaccine, I believe it was about a month out. It was about the 72% effective range in the U.S. Now, I'm always, in full disclosure, that was the U.S., not counting the variants. Neither the Pfizer or the Moderna count variants, though. So it's about 72% effective there, about 52% effective if you calculate the variants. But once again, I'll say that all three were very good at preventing death, and that's the main goal for any of the vaccinations.
I've had both shots. The first shot, my arm was just sore, pretty much. The second shot, I was a little fatigued that day and into the next day. We went with 6 or 7 people. One person got a little reaction like as if she had the flu, but everybody else was just kind of just slow, tired, moving, and that was pretty much the effect of the second shot for the Moderna that we took.
Now, and I had 2 doses as well. And the first time, both times was sore arm, and the second time I was a little tired. But my question is, Dr. Patton, is what if you don't get any symptoms? Should somebody feel like, oh my goodness, it didn't work? Or, if I'm just curious about that. So if they don't get any symptoms, they got both shots though.
No, not at all. It's a possibility of symptoms. Things can range, and some people just their body system responds differently. Long as you've gotten both vaccines and you talk to your doctor, make sure you're not on any things that are suppressing your immunity. You're still protected just like anyone else. And that also brings a point. If you can avoid Tylenol or ibuprofen after you get your vaccines, that's great because those can lower your immune response some. NSAIDs do it more so. So those are like the ibuprofens and the Aleve and the Proxens. If you have to take something in short, take Tylenol because that has a less effect on the immune response. But as you were saying, if you don't have any reaction to it, that's great. Now, you get your cake and get to eat it too.
So if I took a Aleve or one of those others, does that decrease the effectiveness? Or I know you said take Tylenol, but does take any others decrease the effectiveness?
Now, they haven't done an official study on seeing the effectiveness as it dropped or anything. They're just using based off theory that we know what the ibuprofen and things do. But I would imagine that eventually you'll still be at the same effective mark. It may give it a delay compared to if your immune system was able to, because you practice like you play, right? If you're practicing hard to and you go out to play the game, it's going to be like that. So you don't want them to not run as many laps during practice versus the real game. But my hypothesis would be you'll get the same effectiveness, but why take that chance?
So just for clarity, so if someone had the COVID-19 and recovered from it, they still need to get the vaccine?
Yes. We tend to say that individuals who are within that first 3 months may be able to delay it, but once you get closer to that 90 days post-infection and you're eligible, you should be signing up to get that vaccine.
Okay, thank you. So Sam and Isaac, do you know of any ways to get let me start over with that question. Do you know a way to get more Black and Brown communities vaccinated as they've been most harshly affected by this?
Go ahead, Sam. Well, I've been pushing, trying to get pastors on board to start getting to the congregation to talk to individuals. If this is never more point in time in our country when we should be looking at the reason why you can't get to African Americans and you can't get to Latino is because the people who work in our department don't look like us. You don't have a relationship with us. So when things like this, that's this important that we need to be getting out to the community, you have no connection to us, that's going to save our life. And that's the sad part that really affects our community. And as a minority community, we have to start being open to what's going on as well, and be available to talk, to be able to be talked to and talk about what's taking place. I've been really doing a lot of PSAs with the 100 Black Men, PSAs with the health department, because I see the need and the value of what needs to happen in our community for our community. We based ourselves on relationship. Our African American Latinos, we're relational, and so this is one of the things, like I'm telling, are we talking to our CEO at Goodwill about? People are not walking in our door. We have to go to them. Don't just show up when it's election time. Our health doctor need to be showing up before election time. Building relationships with pastors when things like this happen, and clergy. So when things like this happen, you can make a direct phone call to Father Paul. You can make a direct phone call to Pastor YPJ. And then you're able to galvanize community in a way that is need to be done. So if this is nothing more than a lesson that we need to really start focusing on, that we need to have diversity in our health department, with our doctors, in our hospitals, in order for us to be able to combat virus and stuff that's coming to our neighborhoods.
Yeah, I'd echo that. I'd also add in, and I kind of mentioned it earlier, when you think about like some of the rumors or people's concerns about what's in the vaccine or something, it is also sincerely understanding that and addressing that versus like, what idiot would think that? Hey, you want to get the shot? It's like, that's just not how you're going to win over. Like, hey, that's a this or that, right? So it's about how you kind of help steer someone in the way you want to go. So I think and oftentimes leadership, and I think like our county health department, I think has done a pretty good job. I think a very good job, but nationally you see some of that information out there. It's like condescending, like, how dare Black people not want to get a shot?
Right.
Let me tell you some reasons why we might not want to get a shot, right? And so I think then it's hard for that person to be like, come get a shot, right? So I think there's got to be that kind of understanding about why some of these things would happen, or what the mistrust for a lot of Latino community about going to a government organization is. Might not necessarily, for us, it's not so much about the shot. For us, it's more about distrust of the government and like, why do you want me to go there, and why do you want my address, and what if I show up with a passport? And so I think like people need to. And then I think a lot of organizations have shied away from just being direct about it. Like just saying, I don't care why you're here or how you're here. I want to keep you safe. So I want you to come get this shot, right? And we'll accept whatever you've got. I just need to prove where your address is and your date of birth. Come on down, right? And I think some organizations have been like, oh, I don't know if just say it, right? And so like that's part of what I think folks with privilege, and we get the same way, right? So I'm a Latino with privilege, right? I'm a U.S. citizen and I'm well educated. So I think I've also got to make sure I take that mindset of like, who are the folks that are concerned about this, and how do I address what they want? So I think that's what's also hard for those of us that have become doctors and educated and leaders. Sometimes we forget, and we know the people who have forgotten, right? And so we got to make sure that we're up here not forgetting. And speak into our community in a way that makes sense for them to understand it. The other one that I will kind of share about in terms of the percentages or the amount of Latinos that are getting the shot too. One of the things for our community is there's not a lot of senior citizens Latinos are a young demographic. I mean, mostly recently immigrated to this area in the last 20 years and came here in our teens, right? So like, there's not a lot of us that are 50 that qualify for vaccines. And so like when they say like only 2% of Latinos, I'm like, how many Latinos are senior citizens, right? So I think there'll also be a little bit of that, like everybody's waiting till your neighbor does it. And then once everybody else, I think we'll all, like folks will come along. And I think for our community, that's just delayed because of the average age of Latinos is so low. So I'm really hoping that I think it'll be like a social norming kind of thing that once more and more people, like you got it, it'll help. And then we'll have that kind of positive peer pressure about why it's okay. And, if my priest did it, clearly my concern about this is not the same because he's doing it. Okay. I think things like that will help.
Sam, I have a question. Oh, okay. I have a question for Sam. When the opportunity arises, will you be a facility or an organization that will be able to have shots distributed from your organization so that you can have that trust factor, or is that not an option?
No, absolutely. I mean, for us facility-wise right now is a challenge for like us because of our current location. I wish like 6 months ago we'd moved so we'd be in our new space. but St. Adalbert's Parish is actually doing a clinic on the 16th. And there's already, they probably got 10,000 people signed up for that. Like literally, like I've had that form shared to me on Facebook like 90 times. And it's always like, they only got this many shots, so don't tell everybody. I'm like, everybody knows. So I'm already seeing that wave out there. So I'm hoping that's part of what I'm saying with this like norming, that people will do it. But yeah, I mean, ideally we'll be in our facility in another month, and I would love to have our facility be a site so that people can come and do it and feel comfortable. And we've been really leaning on the churches. And I think that's similar where our cultures are, or one of the ways our cultures are similar, right? The church pulls a lot of weight in the neighborhood, especially for Latinos. The Catholic Church, pulls a lot of weight. And so that's where we're excited that St. Adalbert's is doing a clinic. And, I'm waiting for their priests to get shots because that'll help the community too. Because in our community, literally, you do what the priest says.
And that's really key in our city. I know we're going to Johnson & Johnson is supposed to be distributed out at Notre Dame campus. But just think about this. I grew up where you couldn't even go on Notre Dame campus. It's still hard for me to walk on campus to this day, even though I'm on full boards at Notre Dame. Why would I go to Notre Dame to get a vaccine? It's location, location, location. The centers in our community are our focal points in our community. That's what we trust. So why would not the vaccination be at the King Center? Why would not the vaccination be at the Charles Black? Why would the vaccination not only just be at those centers and recreational facilities, but why not be at the housing authorities?
Right.
Why not be at a local church where, okay, we're doing it at this local church at this time, at this day. I feel comfortable going to my church.
Talk with our health officer and I'll
right? But I don't feel comfortable going to Notre Dame.
Yeah.
Even though I'm on 4 boards.
That's
You
very
can't even
good.
find a parking spot.
Yeah, that's very good feedback, Isaac. And I think in addition to like the pandemic shining lights on things locally for us, right? Like we need better relationships with our Black and Latinx community. And we finally have leadership at the department that values that insight, where before it was like me running this uphill battle by myself, constantly not having the ability to do it. But then also I'm hoping from a state level, like so much of the vaccine, like there's such a disconnect between our state health department and our local health departments. And it's embarrassing from my perspective, because so much of the stuff like we found out about the Notre Dame clinic when it was announced in a press release. We're like, who's doing that clinic? Are they in need volunteers? Why Notre Dame? What day? Right? Yeah. And exactly, Isaac, right now it's not going to get the turnout. It could have had the potential because there's all these compounding reasons. So I'm hoping that as we move down the other side of this mountain, we will continue relationship building with communities that have always been underrepresented. And not only do we build relationships, but our team becomes more diversified and culturally humble. And then on the flip side, our local entity works better with our state entity so that we look more cohesive, right? Like when they came out with proof of residency, we're like, wait, we had just put a PSA out that said no need for an ID, no insurance card needed. And then we're like, oh, they're going to need proof of residency. And then that's where we said, you know what, we're just going to go with what we have. We'll err on the side of vaccinating somebody. Just show me an address with your name. That's all we need. But I couldn't speak to Sam or to Isaac's points any better.
And if I could just add this, that the health department in South Bend is doing a great job. I'm not saying that our health department, they even did a declaration that shocked me about discrimination. Yeah. And they being a leader. But when America gets a cold, the minority community gets the flu.
Yeah, you're right.
And we need to be cautiously aware to make sure that the people in our community are getting the things that they need and that they deserve, and that they, as taxpayer citizens, they pay for.
Mm-hmm.
And that's just the main thing that, if this don't wake America up, won't nothing else wake them up.
Mm-hmm.
Well, that's great. As we get ready to wrap up our panel, this has been some amazing conversation and dialogue and dispelling a lot of myths and questions that people may have had, because I'm sure everyone on this call is an advocate for protecting your loved ones in our community. And that is also one of the initiatives of Zeta Phi Beta Sorority, to get this information out, because one of the major ways that we're going to help eradicate this is through education, and especially education of our Black and Brown communities. And reason why we did this panel discussion is to reach those that may not be reached through regular mainstream media, TV or whether, but to put it into the formats, into the venues that they tap into, be it social media or whatever, YouTube, or we're going to publish that on those different mediums, so that we can get this information into the hands of those people that need this information the most, and get them vaccinated as well. Last question I have, does anyone have any vaccination events coming up that we can share? Robin, or Isaac, Sam?
We have, so yes, question mark. I know I've been working with Sam and with Sabora Latino, our radio station, on a registration event where individuals would be able to come and drive through and actually schedule their vaccine appointment with us, since that has been an identified barrier. So we're hopeful to do one of those this coming Saturday, but we're just waiting on a few things to just confirm. So Angela, I probably could have that defined by tomorrow for you.
You just send it out to me.
I will. And then we're hopeful to do one maybe the week after. And then Isaac just needs to tell me where to show up, and I'll show up with my computer and help people sign up. But to Sam's point too, we're starting to see this trickle in, right? Now that enough people have had it, they've seen what it's happening, we are seeing more of our minority communities begin to get vaccinated.
Angela, I just wanted to touch on one thing too. Before I seen Sam has touched on this a couple different times regarding the fetal cells and the vaccine. So I just wanted to bring some clarification to that before people go to articles. Well, has anyone ever heard of the Henrietta Lacks cells? It was in the 1950s where this lady had cancer, and they used those cells against her knowledge or her family's knowledge until later on. But with those cells, they were able to create a lot of cures, such as for polio and the HPV vaccine, which is an increased risk for cervical cancer. So a lot of good that came from those cells. But as terms to the Moderna and the Pfizer, they did use cells, cell lines from different fetuses, or pretty much the cells that can transform to other, could pretty much just be any other part of the body if you catch it early on. And the difference between the Pfizer and Moderna, how they use the cells, and the way Johnson & Johnson use their cells is a little different. The Pfizer and Moderna, they use the fetal cells, or we just call them the cell lines now, because they're like the great grandchildren of the initial cells, because they use it to replicate the cells. They tested the vaccine on the cells to test safety and efficacy of those vaccines. And best way to do that is to kind of use actual human cells, which that's a common practice in some vaccines, of testing on those cell lines. Now, so after they tested on it, they didn't actually need it to, they didn't use any cells to make the vaccine. They just tested on those for safety. And then they use, like she was saying, they have the lipid coat that's what the mRNA is coded, and that's how they deliver it. The Johnson & Johnson, there's also no fetal cells in the vaccine, but the difference is those, as far as the virus is concerned, like she was saying before, the adenovirus that they're using, the adenovirus can't grow by itself. It has to replicate in the cell. So they use those cell lines from the retina or the eyes of a aborted fetus around the 1970s, like I said, and then they replicated those cells, and this the cells they were using for research. But they grew the virus inside of those cells. So once they grew the virus inside of the cells, they took the virus out, which was pretty much an empty shell though. It was an empty shell of a virus that they grew from inside of the cells. And then those cells were removed from the vaccine, and now you just have the virus. So it was more like an incubator for the adenovirus. The incubator and the cells were removed, and now you just have the adenovirus when you get the vaccine. So there is no fetal cells in either vaccine. Fetal cells were used to produce one of the vaccines, and fetal cells were used to test with the Pfizer and Moderna. So I just wanted to bring clarity to that.
Thank you for that clarity. That I'm sure that will help someone along the way too when they're trying to decide on taking the vaccine or not. That is about our time. I appreciate everyone taking time out of their day to help with us dispel some of the myths for our Black and Brown communities. And for those that may be watching this video, please feel free, share it with your friends, share it with your family, because that's the best way to make sure that we get as many people as we can protected against this virus that has already claimed the lives of way too many people. So thank you all for your time. Zeta Phi Beta Sorority thanks you all for tuning in and stopping by, and please mask up, stay protected.